Welcome everyone. Today's session is on the infection control plan and procedure for home care services. We are committed to minimizing the risk of infections among clients, staff, visitors, and the broader community. Our approach aligns with best practice standards, legislation, and the NDIS quality and safeguarding framework. This training ensures everyone understands their role in infection prevention and response. Purpose. The purpose of this training is twofold. First, to outline standard and emergency infection control practices that must be consistently followed. Second, to ensure that the organization is prepared to respond promptly and effectively to any outbreaks or infection-related emergencies. Infection control in the community and health services industry. Infection control is a key requirement across many sectors of the community and health services industry. We all expect hospitals, aged care facilities, recreation centers, and leisure services to implement rigorous procedures that protect both clients and staff. Although infection control guidelines and standards can vary between organizations, they must always be specific to the services provided. For example, the required standards might cover areas such as maintaining clean and hygienic staff kitchens, strict toilet cleaning procedures, or more complex protocols that affect the entire service model, such as in residential aged care facilities. Regardless of the core business of an organization, it must fully comply with the applicable guidelines and standards set for the industry. These standards may include Australian, European, WHO or USA guidelines, the National Health and Medical Research Council, NHMRC infection control guidelines, relevant industry codes of practice, and state, federal, and local government health regulations. Additionally, manufacturers' operating manuals and recommendations for equipment and cleaning products must be followed carefully. Drawing on these regulatory documents, an organization must develop its infection control policies. From these policies, specific procedures and standard precautions are created and implemented to ensure consistent practice across the workforce. An example of such a procedure would be the measures staff take when they come into contact, or are at risk of contact, with body fluids that could transmit infections. Infection control policies and procedures typically relate to the design and maintenance of cleaning procedures and schedules, the proper use and care of cleaning equipment, the handling, storage, and disposal of all types of waste, infection control risk management practices, and the correct reporting of infection control incidents and hazards. Principles and practices of standard precautions. Most healthcare and community support organizations require two distinct levels of infection control practices. The first level is called standard precautions. These describe the basic work practices that are recommended for use with all clients, providing the minimum level of protection for everyone, clients, staff, and any others present. The second level involves additional precautions, which are used alongside standard practices, but only for clients who pose particular infection risks, such as when dealing with known cases of airborne, droplet, or highly contagious infections. Standard precautions must always be used as a routine part of care. In the vast majority of cases, standard precautions alone are sufficient to provide appropriate protection. Standard precautions include practices such as thorough and frequent hand washing, the correct use of protective wear like gloves, gowns, and masks, maintaining environmental cleanliness and hygiene, safe waste disposal methods, and immediate action following exposure to blood or other potentially infectious body fluids. A critical principle to remember is to treat all blood and body fluids as infectious, regardless of the client's medical history. General best practices to maintain infection control include wearing disposable gloves whenever performing tasks involving contact with body fluids or broken skin, or when handling items or surfaces soiled with blood or body fluids. Hands must always be washed both before and after such procedures, regardless of whether gloves are used. It is essential to protect broken skin by covering any wounds on your hands with waterproof dressings and ensuring gloves are worn if there is any chance of contact with body fluids. Contaminated needles and other sharp instruments must be disposed of correctly using approved sharps containers, and injections or blood sampling must only be performed by qualified registered nurses. If accidental exposure to blood or body fluids occurs, such as through a needle stick injury, an open wound being contaminated or contact with blood-contaminated saliva, it must be reported immediately and appropriate post-exposure procedures must commence without delay. Cleaning up spills of blood, urine, feces, or other body fluids must also be conducted according to approved spill management protocols. When general best practices are not followed, or when an incident occurs, there is a clear procedure that must be initiated immediately after the injury or exposure is sustained to minimize risk and ensure safety. Relevant legislation, standards, and agreements. Our infection control practices are based on current legislation, regulations, and best practice standards. These include the NDIS Quality and Safeguarding Framework and Practice Standards, the National Health and Medical Research Council, NHMRC, Infection Control Guidelines, State and Territory Health Department, Infection Control Guidelines, and Workplace Health and Safety legislation. Our work is guided by the following core principles. We focus on minimizing risk through proactive infection control measures. We adhere to evidence-based guidelines and legislative requirements at all times. We commit to regular training, education, and review of infection control practices. We act quickly and decisively when an outbreak or exposure incident occurs. Let's look at a procedure overview. First, standard precautions. Hand hygiene is mandatory before and after all client contact, after removing gloves, after exposure to bodily fluids, and before handling food. Hand washing with soap and water, or the use of an alcohol-based hand rub is required. Respiratory hygiene and cough etiquette must be observed by covering coughs and sneezes with tissues or elbows, disposing of tissues immediately, and performing hand hygiene afterwards. Personal protective equipment such as gloves, gowns, or aprons, masks, and eye protection must be worn appropriately according to the task and risk of exposure. Proper techniques for donning and doffing PPE must always be used. Safe injection practices must be followed using a septic technique at all times. Needles and syringes must never be reused, and sharps must be disposed of in puncture-resistant containers immediately. Waste, including clinical waste and sharps, must be managed according to compliant procedures. Routine and incident-specific cleaning must be conducted using appropriate cleaning and disinfectant products, and soiled linen must be handled carefully with safe laundering practices in place. Transmission-based precautions. In cases where specific infections are identified or suspected, additional precautions must be implemented. Contact precautions require the use of gloves and gowns for infections such as MRSA or norovirus, and where possible, dedicated equipment should be used. Droplet precautions, such as wearing surgical masks and maintaining appropriate distancing, apply to illnesses like influenza and pertussis. Airborne precautions require specialist arrangements, including the use of N95 respirators for diseases like measles or tuberculosis. Emergency infection control procedures. During an outbreak, early detection, risk assessment, and the swift implementation of control measures are essential. Clear communication with stakeholders and a thorough post-outbreak review must follow. In cases of exposure, immediate first aid, reporting, and medical follow-up are required for both staff and clients. All incidents must be fully documented in accordance with policy. Practical implementation and monitoring. Infection control measures must be continuously monitored to ensure compliance, including availability of hand hygiene facilities, alcohol rubs and visual reminders, readiness and correct storage of PPE, appropriate safe injection practices where applicable, proper waste management and disposal of clinical waste, effective cleaning and disinfection routines for client areas and reusable equipment, correct management of soiled items, including safe handling and laundering, staff infection control training at induction and annually thereafter, regular site audits and corrective action reviews, and a clear understanding among staff of infection control roles, responsibilities, and reporting protocols. By following our infection control plan and procedure, we can ensure a safe and healthy environment for everyone. Infection control is not just a regulatory requirement, it is a shared responsibility and a core part of providing high-quality care. Thank you for your ongoing commitment to keeping our clients, staff, and community safe. Read more and check your competencies by reviewing the current organizational policies and procedures, and ask your team leaders. You will more than likely be tested annually, so keep compliant.